I've been a little disappointed by the public displays of funding that have emerged. What I have heard is that they are doing more in the shadows to kind of support, but they do not want to draw the public attention
Mm-hmm.
of the
Mm-hmm.
administration. I hope that's true. I've also heard from a lot of organizations that they don't have as long as they would like to be able to make the pivots, and that the work they're doing is mission critical for the people they serve, and they don't have a way to deliver on that. So philanthropy as a whole, and there are many exceptions to this, has not moved publicly as fast and as decisively to provide value in the ways that I was hoping. And nobody wants to fight this administration. So I understand those things, but I also was hopeful that there would be more stepping up, and there hasn't been.
Nick Martin, what a pleasure to have you on the Global Perspectives on Digital Health podcast. Welcome. We are going to have a really, really great discussion today. I'm really looking forward to kind of getting your wisdom, insights, and some of the things that you've learned along your many years in the development sector. So welcome.
Hey, listen, Shubs, great to be here. Looking forward to getting a chance for us to talk about all things social impact, digital health, and more.
Nick, you're like probably one of most well-connected people in the social impact space that I've seen. Tell us about yourself, how you got into this space and the work that you're doing.
Yeah, I don't know where to start. I was a modern poetry major in college at Swarthmore College, and studied peace and conflict as well. And then my father was really set on me becoming a CIA agent, and I got in a big fight with him over an internship that he'd arranged for me with some of his friends, and decided I wanted to go and teach English literature. And then from there, decided that I wanted to take the education piece, which I loved so much, and really look at a more international career. And that's when I found this amazing program in Costa Rica that did education, peace, and human rights peace and human rights alongside education, with a United Nations flavor. I just loved it. I had a great time and came back from that. And I was like, you know what? Technology is disrupting and changing everything that we're seeing with education. Maybe there's an opportunity to connect some dots specifically for the humanitarian, global health, global development population, and bring new kinds of training and learning to them using the power of tech. So that was the kind of origin instinct around TechChange. And we were lucky to grow up at a time when a lot of these technologies were just becoming available to do distance learning and online education. And we were able to marry that with a whole slew of experts and incredible humans, mostly in DC, but all over the world, who were willing and ready to share their expertise and knowledge with students in professionals in cohort-based learning settings. So that was the early days of TechChange, which I'm happy to go deeper on, but a bit of history there.
So when was this? So that you had started this?
Yeah.
Like what year?
Graduated in 2006, and then started TechChange in 2009. And in that interim, grappling with where and how I wanted to show up for the community, and
Yeah.
also a financial recession. If those of you who were working at those times remember, it was tough. I was out there applying for jobs. Have a lot of empathy for job seekers as a result of that period in my life. Hundreds of jobs, getting rejected, trying to find my footing, and ultimately landed on this idea to start TechChange in around 2009.
Yeah, and so I guess things are cyclical, and kind of we're kind of in this wave right now as well. So we'll come. I think will be great to come back to
Yeah.
what you learned then and what applies now still. So you started TechChange in 2009. You've got quite some years under your belt, and over the last few months, I've talked to a lot of my guests about their perspective from their layer of the ecosystem. What's been the impact of the USAID and other countries' development aid budgets being completely cut and slashed? And I feel like you have such a good view on this, and particularly wider than I guess like healthcare as well, because you touch other sectors as well. But maybe we could start with before. What was your experience of it? What were your big successes, challenges, etc., and the main things you've learned? And then maybe you can go into what has the last 8 months been like from people that you know in the sector, and the impact that you've seen on people either in the last mile in the places affected, but also your colleagues or former colleagues who've like lost jobs, etc.
Sure. Yeah, lot to cover there, but I'll do my best to parse it out. So TechChange, because we were invested in digital training and learning, we grew exponentially during the pandemic. We had enormous demand for all of our services and tools. We were seeing a lot more investment, not just in development, but in our niche of digital development, digital health, we're talking about today. And that growth was supported by a lot of the policies in the United States, with USAID growing and supporting an expanding catalog of digital programs and partnerships. And so coming out of last year, we saw USAID quite large and supporting quite a bit. We saw other funders really starting to understand the importance of digital. I think with the rise of AI, we've seen so many new entrants to thinking about creative solutions for applying technology to development. Some of them great, some of them terrible. We can talk more about that. But I think that the mood and the mindset and the temperature of 2024 was all quite positive. And then turning the corner into the year, I was at a tech salon with Wayne Voda that he'd organized. Even then, we were starting to, as a small group, sort of think about what was Trump 1 like, and how can we position and pivot accordingly to make digital development resonate with a new administration. So there was still, I wouldn't say there was optimism, but there was at least a feeling like, you know what, like we're going to survive, it's going to be okay. And I think really in that moment did not anticipate just how swift, abrupt, and drastic that, for lack of a better word, transition was going to be. So that's the before times. I'll stop there if you have any reflections. Then I can talk about the now times.
I guess before you get into the now times, a lot of people saw that it might be coming and thought, okay, well, if it happens in a certain graded way, maybe some aspects of it are a good thing, right? There were some anti-patterns, like some things that were not, maybe could have been approached in a different way. Do you have any reflections on that? Things that you've learned along the way?
Well, at that same tech salon, I think we were certainly talking about digital public infrastructure as a subset of projects and as a movement resonating with this group. Certainly the localization drive to localize projects and partnerships had a lot of resonance with the journey to self-reliance for under Trump 1. So there were definitely things we thought, they could stick. And if you'd asked me what was maybe not great about the before times, I do think, and this we can talk more about, that there are many amazing projects in humans working at USAID and the agency, but I do think it had gotten quite large and there was not a ton of coordination in certain parts. And so I do think that some of those criticisms are warranted, that it almost gotten too big for it to be valuable at scale. But I think no one anticipated the swift destruction of everything, right? That was a surprise. So I do think maybe you could make the case that there was not enough coordination, and that some projects needed to be reevaluated. And we can think more about health specifically there. But on the whole, projects were having great impacts. Partnerships were doing great. People loved the American people for the value and the services they were providing through or USAID and their partners. So, I think this really did become quite swiftly a political thing. And then I guess the other thing to mention, which I'm sure has come up in other interviews and in various channels, but we as a sector, we did not do a great job of trying to make the case to the American people the importance, the value, the merit of global aid, right? And that got very easy to politicize without a strong lobbying infrastructure and without a strong voter base. People tend to vote based on issues. Our very small niche just didn't have that populist support. So I think that made us an easy target, and it allowed other forces to kind of quickly come in and lock and tie things up in the courts that ultimately made it very hard to win back. Anyway, that's a long and messy topic, but I do think those factors how could we coordinate better across the sector with our various projects and implementations, and how do we build a better political lobbying constituency so that the American people really understood the value of what we did in the world.
Yeah, I like that. I think that piece, there's so many parts of this around like owning the narrative, science comms, that this touches on, right, as well, which is just so topical right now. Definitely in the world, but particularly in the US right now, right? Thanks for sharing the kind of before and also like your really authentic reflection on what could have been done better. Maybe let's go into like, okay, then the ball drops, right? This swift action comes. Stop work orders, like people losing their jobs left, right, and center. How did you experience that in your local sphere?
Well, I had just come back from vacation. I was living in Costa Rica with my family for a couple months. We'd just come back from a vacation stint, and literally that Friday, everything fell apart. It was a mix of being on a number of phone calls. I was on a phone call with Catherine Rafelson, who leads Society for International Development, on the Friday when everything was falling apart. And obviously, she manages a large membership org, and we were both just trying to make sense of these executive orders. And I don't think it had fully set in. And then in the following week, it really got quite real. And my first instinct was to try to get a website up to talk about the effects of the freeze, and it was entitled Global Development Freeze or Global Aid Freeze, I think, .com, and got something up and used my LinkedIn platform quickly to try to just provide a way for people to share the stories of how they were being affected, specifically at the project level, but we ended up getting a lot of individual responses as well. And that response was overwhelming. I had a number of journalists contacting me in those early stages to try to everyone was just playing catch up, trying to figure out what the hell's going on here. And, even folks at the agency were in a bit of whiplash. How long would they have? Even in those first few weeks, some of them thought, well, I can still, put money into places to protect it for the following year. And every additional day got more and more bleak. So that was super rough. And then I put up a couple posts early on that got a lot of traction, trying to make the case for USAID, albeit too late. Sharing Samantha Power interviews. I put up posts around asks and offers. What do you need, and what are you willing to offer on the community level? And those had thousands of comments and responses. So, I do want to say, like, it was great to have that platform, my several 100,000 followers already available to me, the platform available to be able to provide that support. But really, it was driven entirely by the community, people wanting to help people. I think the resilience and the generosity were so tremendous. And if I look back on those early days, that's really what I want to remember, is not the cruelty and the kind of flippant nature of this decision, but the way that the community rallied and
Yeah.
connected in a time of need. So anyhow, that's my big reflection there.
Yeah, people who are generally working in the sector, pretty resourceful, have had to kind of come out, work in some pretty challenging situations, context, environments, etc., and then kind of having that kind of pressure thrust on them, and kind of having the power of community to kind of come together, right?
I mean, these are already humans that work hard in extremely complicated, challenging environments on pretty traumatic and bleak issues: global health, democracy, peace and conflict. These are tough jobs that are hard not to bring home with you. And then on top of that, to have the work itself, the job security itself, thrown into question in the way that it was, just so unnecessarily cruel. So that's my hot take for the moment that we found ourselves in January.
And maybe just kind of one more thing on this. I heard lots of stories kind of from kind of the last mile of healthcare where, like, literally day and night, suddenly, like, supply chains were gone, digital infrastructure for surveillance, public health surveillance gone, medications that were like life-saving and needed healthcare workers to administer them, all of that was gone. In terms of the stories that you had shared in those posts and the kind of website you'd shared, do you have any examples of those types of stories, like just seeing firsthand what was going on?
Yeah, there were quite a few, and I think you've touched on a lot of the big, life-saving challenges that we were up against. You know, what the projects that we ran that I know the best, probably what I can speak to, were we ran a project called Digital Health Planning National Systems, and it was uh, a long-standing partnership with the Global Health Bureau at USAID. We would go into countries ministry by ministry and train senior officials in how to digitize and bring their health systems up to speed and strengthen their health systems. And this entire program that had a whole year planned of tons of capacity building and partnerships destroyed overnight. And we have a wait list of over 1,000 people on this who are just hungry for this kind of training. Why? Because ultimately they do want to digitize and interoperate their health systems. They want to be more self-sufficient. They want to work thoughtfully with the right partners from other parts of the world. All of those instincts are what this administration seemed to also want, and yet we're in a situation where that work was abruptly cut short. So, uh, again, maybe less sexy than the last mile worker that doesn't get their care, but like this is all part of a larger ecosystem.
Yeah.
And we were on a path. We were on a path to doing tremendous good. And that particular project, Gates Foundation has come in and is hopefully going to support some of the deliveries of that training and working on building an AI module. But this is the slow, prudent, hard, challenging work that is really required in strengthening health systems. And this is the kind of stuff that the U.S. government was funding. There are, I would say, more philanthropies and businesses that fund social enterprise and kind of are a little more story driven in how they save lives and provide care for populations. U.S. government was really trying to think about infrastructure, and this is just one example of across many that is now gone, unfortunately. And so I think it's only we're already feeling the effects of that in lives lost and kids not vaccinated and malnutrition and all of that is coming up. We're getting real data around those stories, but the effects of this will carry forward for years.
Yeah, and now we're kind of 8 or so months in, right? You gave the example of like organizations like Gates stepping in. Still, important work needs to be done to kind of salvage operations. And a lot of the kind of talk around this has been, okay, well, we've had this crisis, and now there's this opportunity as well to think differently as well, particularly on how decisions around local infrastructure are made. How do we create local ownership that is self-sustainable and kind of doesn't rely on this kind of like single point of failure that relies on like the geopolitical compass? What's your read on this kind of, hey, there's this crisis, but there's this opportunity to think differently as well?
Yeah, I have a lot of thoughts here. I think the way I've been thinking about it is a reckoning and reimagining. I think crisis forces creativity. I think that is a truism that I live by as an entrepreneur. I do think it's happening across the sector. At the organizational level, I think we are seeing now 8 months out more organizations thinking creatively about mergers and partnerships with each other. I think we are seeing, and this is an effort that I'm happy to talk more about, uh, more groups pivoting to their business models to think about selling their services directly to governments, thinking about their offerings more in terms of products. We at TechChange are launching an accelerator program to help organizations with that transition and journey where they get proper sales training, but also all kinds of resources around what a successful merger might look like. And then there's another camp that are just in a world where they're going to have to wind down in a dignified way. How do we help them do that with grace? I think that is a big discussion 8 months out. It's just how long is the runway? For those larger orgs that are still around, I think it's a really challenging runway. Like they have some projects that survived the massive cuts, very few assurances from this government that they will be paid for that work, and a lot of costs that are required to keep those projects running, plus overhead. If you're a large implementer in this environment, it's a really precarious uh, 18-month runway, right? You just don't really
Hmm.
know what you're up against. And then for individuals, I think that it is also mixed. I think that many amazing humans lost their jobs and are now trying to make sense of what it might look like to be a consultant, a portfolio career person, where they are providing value to a range of clients without full-time benefits, healthcare, all the things that we as humans in this sector really do care about. So that's hard. I think some are finding real meaning and peace with that, but maybe not the journey they would have chosen for themselves. Others are landing full-time jobs. It is a very complicated and challenging market right now, and I'm happy to talk more about that. But tough. Those full-time jobs, especially in the tech meets social impact space, are very competitive and challenging to secure. So that's a bit of a high-level overview.
Yeah, and maybe zooming into two of those levels. One, in terms of if you're a non-profit or you're an entity that's been affected, right, by this funding hole, there's a lot of philanthropy and even private investment that has stepped in, right? You talked about Gates, but there's also, I've had Rowena from Africa Health Ventures on the podcast as well, talking about, hey, this is an opportunity as well and you talked about business models and actually using the know-how and use of VC investors to like, hey, how do we invest in you creating an actual economically viable business out of this, right? So I really like that you hark towards that. And so there's those options if people are in this situation. And at the individual level, yeah, hyper competitive market, both for people kind of going into consulting and also for people who are like pivoting their careers. And I know you post a lot on social media around jobs, impact jobs. So, if you're listening to this and you haven't and you're not already following Nick, please do. Always lots and lots of interesting resources, but also like actually direct like funding opportunities, jobs, etc. in the social impact and also obviously digital health sector as well. So, and you mentioned someone at the beginning of the podcast, Wayan Vota, and he's got his career pivot website as well. And so these are really good examples of like how you guys have kind of come together to like really help this community who felt like, well, like I'm a castaway here. Like, how do I like ground myself back in? Like, what the hell is going on?
Yeah, there's certainly a lot of dissonance that has happened to the humans who have powered this sector and industry over the past 8 months. I think there's a settling into a new world order happening. I think there's still a lot of frustration with what the medium and long term realities might look like. Will it get worse before it gets better? These are all open questions, but we're trying where we can to add value. And yes, definitely every Thursday I post 20 jobs that I come across with my colleague Caroline. She helps me curate it. Wayan has just transitioned career pivot over to another colleague of ours, Joe, but
I
he's
saw
got
that. Yeah, yeah,
big,
yeah.
big, big plans for that, and there's a number of amazing resources for folks. And so, yeah, I think that it's going to take a lot for us to reimagine, and I think coming to terms with the reality that it may not come back in the way that we expect it to, if it comes back at all. And so, what does that trajectory look like? Certainly, I am seeing some folks leaving the sector entirely, very understandable. Others just trying to take some time for themselves, and if you can't afford to, just hitting pause on the job search is another kind of mental health move. I think it may start to get a little better in January, a couple months from now. But at the same time, I am seeing colleagues get hired and find new roles and so forth. And I think to your other point about funders, I've been a little disappointed by the public displays of funding that have emerged. I've had a couple LinkedIn exchanges with John Palfrey at MacArthur, who took the endowment at MacArthur from 5% spend a year to 6%, really hoping to see more larger foundations follow suit. What I have heard is that they are doing more in the shadows to kind of support, but they do not want to draw the public attention
Mm-hmm.
of the
Mm-hmm.
administration. I hope that's true. I've also heard from a lot of entrepreneurs and organizations that they don't have as long as they would like to be able to make the pivots, and that the work they're doing is mission critical for the people they serve, and they don't have a way to deliver on that. So philanthropy as a whole, and there are many exceptions to this, has not moved publicly as fast and as decisively to provide value in the ways that I was hoping. But uh, there are many reasons for that, and
Yeah, it sounds like it's a bit of a pickle, really. If it's like a really simple way to put that. It sounds like there are like competing externalities, dependencies. Organizations are trying to be careful around how they publicize the work
sure,
that we might
everyone's
be doing. So
afraid. Everyone's
yeah,
afraid. Nobody wants to fight this administration. So I understand those things, but I also was hopeful that there would be more stepping up, and there hasn't been.
yeah. Yeah, thanks for sharing that. I actually just recorded with someone who had developed a app in Turkey for maternal health and child health for Syrian refugees, specifically for them, using refugee developers who were in the camps to help develop. It was like a really real and frank conversation of how they like literally had the rug pulled out from under them, and yeah, they've also struggled in a way to readjust, like really cut back their offering and their plans for expansion and impact, etc. So yeah, it's really tough out there, like you said. Nick, let's kind of talk about something that gives you energy. You know, painted kind of a kind of maybe a somber picture of what's going on, but there's a lot of good stuff happening that you said as well. I'd love to know about TechChange and the work that you've been doing. Why did you create this? You kind of touched on it before, but let's get into the story of TechChange.
Yeah, thanks for that, Chubbs. Look, I mentioned a bit of the origin story. A passion of mine for over the last 20 years has been trying to provide education and training to people all over the world through the power of technology, training and learning that saves lives, whether it's global health, whether it's humanitarian aid training. That's been a major theme. And as we've grown up as an organization, we've shifted from doing that training on a kind of one small cohort-based learning model to working directly with organizations. We've partnered with over 300 orgs across 1,000 trainings and a couple hundred events in those 20 years, and really had a chance to extend and deepen the amazing work of some of the most phenomenal orgs in our sector. So, at the root of it, it's really been how do we bring people together? How do we provide them with more skills? How do we help them connect with each other so that they can solve what are really challenging and intractable problems? And so when the pandemic happened and all the conferences were canceled, we raised our hand and said, we will build a virtual global digital development forum, bring everybody together. We had 6,000 people together on a platform that we had basically repurposed in 7 weeks which was not an event platform, but there was nothing that existed technologically. And just enormous credit to our team and our partners in that moment for really trying to provide value and meaning and connectivity to a community that was hurting. And that's really been our thesis throughout. I would say now the challenges have changed in 2025. The pain is really one resulting from funding and these programs being cut, but here we are trying to kind of build accelerators and trainings and learnings to help people pivot, and also to bring folks together for the Global Digital Health Forum, which is a conference that we were working on during pandemic times as the virtual partner, and then took over the in-person production of in the last 3 years. And so that is still full steam ahead in December in Nairobi, and really excited to be bringing this community together, digital health professionals and champions around the world. Just an amazing subset of humans. And I got to say that despite everything, we are seeing strong momentum and excitement around sponsors and tickets, people wanting to be there. And I think even beyond excitement, we got to get together as humans. We got to connect. We got to figure out how to reckon with and reimagine this new world order. And so we see this event in Nairobi as a big opportunity to do that, and quite a hopeful one, a really quite positive and optimistic one.
I remember when I started this podcast about a year and a half ago now. And the first couple of people that I kind of interviewed on this podcast kind of said to me after the episodes, "Hey man, you should like try and go to the Global Digital Health Forum, which is going to be in Nairobi in December." And it just wasn't possible for me. But I remember kind of following it, and it's like having like deep FOMO, basically thinking, "Wow, like there's a lot of." I knew a few people who were there. It was really like seemed like, wow, like such an awesome group of people to just like have densely packed into a conference space, right? And learning from each other, etc. And I kind of was like, oh, I really, really want to make sure I go the next year. And then USAID kind of funding cuts happen, and I was like, oh, after all that energy, is it going to continue? And like, so I'm so glad to hear that you've managed to kind of continue the energy to kind of have it this year. What can you talk a little bit about kind of how your focus, like it sounds like a big focus is going to be like, hey, given like everything being on fire, basically, how do we come together and really like I guess like there's a like we've had this volcano erupt, right? There's lava everywhere, like the village of Pompeii is decimated, but with that there's like this fertile soil now for like something like thinking about things new. That's what like the mental model I have of like this, and like maybe what you're trying to do there as well.
I think you've nailed it. So I'll just say a little bit of history on this conference. It's been going since
Yeah.
2009. For the vast majority of that stretch, it was an in-person conference in Washington, D.C. We helped to bring the conference virtual, and there was a year where we just did it fully virtually, and then we brought it back to DC, and then the community really, to their credit, was like, look, we got to move this thing out of Washington. This is too exclusive. It's too hard to get to for the vast majority of our community members.
Yeah.
Let's get this thing. It doesn't have to be in the same place every year, but it should not be in Washington. And so 2024 was the first year, if you can believe it, 15 years in, that we moved this conference successfully to the African continent and to Nairobi. And the attendance was incredible. The energy was infectious. Everything about it was really, really dynamic and awe-inspiring. And so, I think had we kept it in DC, it would have been a lot harder to, I think, to fully kind of feel the power and the self-sufficiency of this community beyond the support of USAID. But now that we've done that, obviously it will be a challenge, but we're seeing a lot of companies and non-traditional foundations and funders kind of come along and looking at this event to sponsor, to convene their smaller subset community to take advantage of the energy, as you say, that's there. So I think that's really encouraging. And then to your point, yeah, I do think this is a great opportunity to reimagine and to start to develop some really powerful cross-pollination. It is the conference where you get Ministry of Health officials, with social entrepreneurs, with implementers and clinicians and IT professionals. It's such an incredible cross section of humans, all focused on digital health in a really collaborative and communal way. So I'm glad you're coming. I would encourage anybody listening to also get their tickets and join us. It's going to be amazing. We also had a ton of participation from the African continent, which we should shout out. Like 25% from Kenya alone, 45% from the continent. So almost half of the humans that were there were invested in digital health in the region or on the continent.
And I think that's so important, and that step you took to kind of move it to somewhere like Nairobi, right? Often people who are actually like there in the field doing the work, right? Whose insights I believe, like why I've created this podcast as well, should be like the stories that get shared. Often, if that's in like London or Washington, etc., it's hard for those people to kind of be there and kind of take the floor and like share their direct first-hand perspective, because of like the way visa schemes and things like that are set up. I'm making an assumption here it's relatively easier to get to be in Kenya. I think that it seems like a good step that you make it more accessible for people who are actually doing the work as well, and kind of we talk about local ownership and making sure you have good representation. So that seems like a great step. One of the things I'm excited about is that you mentioned this person, Wayan. We had done this in Geneva. We had done this thing called a Fail Festival, and I know that you and Wayan are like the OGs of the Fail Festival in this, because we're going to be doing a Fail Festival in Nairobi, and I'm very, very excited about it. Can you tell us about like your story with that, and you and
Yeah.
Ryan like working on that?
Yeah, happy to, and excited that this is coming up. You know, Fail Festival, my experience with it dates back to, I want to say, 2010. So really the origins of TechChange. There were initially quite small gatherings of humans who would get on a stage. I remember the early days. There was one at the World Bank. There were a few at an FHI 360 conference hall. But it was such a great format. The idea was you find humans who are willing to have a more honest, sometimes funny, sometimes sobering, but always raw and unfiltered sharing of experience about what didn't work. And so it just became really important for the community to hear these stories, because in a way, we're always competing with each other to put on a sheen or a veneer to the funder to say everything went great. Well, under the hood, everything's on fire. And just being able to commiserate and to really understand the realities of execution and just how hard these problems are that we're trying to solve, uh, was just really, really connected with people and that message. So we hosted, maybe by 2013, 2014, not only were we hosting, we were also participating in them. And I got together some of my colleagues who were musically inclined, and we, for I think 3 years, wrote a bespoke song for the community and performed it at FailFest. And happy to dig up some of those for your comment section. But I,
Amazing.
I was basically, the lyrics were hilarious. We were trying to yeah, just kind of share honestly all the things that didn't go well in our year. And some of it was funny, some of it was educational, some of it was just sad. But look, that's part of the experience, and have can speak to many other creative formats that other colleagues took on in service of this concept. So glad to see it coming back. It's going to be awesome. We're going to do it at Global Digital Health Forum this year. Wayan and Chubbs, it sounds like, are gonna help make it awesome. So one more reason to come out in Nairobi this December.
I just think it's such a valuable way to talk. It's real, right? Like you said, like in conferences, yeah, okay, part of it is we've got this like commercial goal to always be selling, da da da. But actually, what people really connect with and engage with is that like the relatableness. I just remember like the one experience that I've had of like hosting it and telling my own story. Like people just found that so useful, and like the argument is like actually most things, even the successes that we have, are propped up and on the shoulders of like the things that had gone wrong before you got there, and you only shine the light on the thing that went right. But actually, there's so many things that we can all learn from the things that have gone wrong. And imagine that story you had, or that thing that you had in your use case or your context. Imagine that's like propagated times 1,000 other contexts. And if you can share that in a structured way, people are like, I wouldn't have thought of that. Maybe I'd avoid that. Can you think about that, the impact of that across like hundreds maybe, or thousands of other examples where people have said, oh yeah, we better avoid that pitfall, right? So yeah, that's so valuable. Anything else to say? Any last words on that?
Yeah, excited to have everybody come out. Looking forward to it. We're going to have an amazing experience. I'm also going to be leading a bird watching tour. I'm a big
Nice.
birder, and my wife got me into this hilarious and wonderful hobby. So we're going to get up early one morning and take some folks out. So beyond all the amazing digital health sessions and community building, there's a couple kind of fun subplots that might be interesting for folks. But yeah, looking
Awesome.
forward
There
to
you
having some
go.
people
There you
join
go.
us.
Join Nick on bird watching. Nick, so before we kind of close out here, it's been so valuable talking to you. You've been in this game, working with a lot of people, creating impact in social impact. I feel like you've learned a thing or two to kind of be able to have a section of like Nick's Wise Corner. Like, what are your kind of key things that you recommend to people who are building in this space or looking to kind of create impact in the right way? Have you got some recommendations for people who are A, starting out their journey, or B, going through some of the challenges post USAID cuts that you've been talking about?
Yeah, look, I think we're entering a period of scarcity. We're already in a period of scarcity, as we've talked about at length on this podcast. So I think just if you're in an organization, trying to be really honest with yourself and your colleagues about what the runway looks like, trying to be data driven in that analysis. Can you pivot your business models? Can you develop new products and tools and services? Does it make sense to merge? Is it better to gracefully wind down? I think that is the period that we're in right now, is really trying to think about that adaptability for organizations. For humans, I think it's similar. I think it is. My advice for a new grad may be different from a senior, mid or senior year career person. I think that new grads are really at a tough stretch. Not only do they have to contend with the sector and the funding fallout and the government challenges, but also the rise of technology like AI that is really suited to replace task-oriented things and a lot of sort of junior level abilities. So I think the advice I have, if you're at the beginning of your career, is to be on the wavelength that learns these skills. I share often various trainings and resources for how to skill up and how to get ahead of the curve. And a lot of these are specific to AI skills for the nonprofit social impact sector. I really think that that blend of having the technical abilities plus the sort of sector sensibilities is a powerful combo. And I would say, like, when we started TechChange in 2009, nobody had jobs. We were able to kind of build something beautiful because talent was cheap and nobody had alternatives. And I kind of come back to that theme of constraints and chaos breeds creativity. And so again, if you're starting at this career in your earlier phases, what are the opportunities that are available to you? Can you work abroad? Can you start a small company with your colleagues? These kinds of things can be really powerful. And then I would probably add to that, wherever you can, often and always prioritize learning and community. Like, we are in a state of constant reinvention as humans, not just in our sector, but across all sectors. So the more you kind of shift your mindset and orientation to never stop learning and build and scaffold that journey with incredible humans and community, the more powerful you will be for any of these shocks and challenges that do arise. And so it's made a huge difference in my journey. I think it's never been easier to do on LinkedIn, and I could spend a whole podcast just talking about that. But at a minimum, spend some time on there, build your virtual community, and prioritize it in your trajectory. So that's all I got, Chubbs. Hopefully that's helpful for a few folks that are listening and excited to. Yeah.
That sounds awesome. And yeah, like your motto on there is always like sharing is caring as well. So like, building that community, sharing resources, etc. as well. Nick, it's been so valuable to talk to you. We've talked about kind of the state of development, particularly in digital health, and your experiences on kind of the fallout. We've talked about the work that TechChange have done. We've talked about the exciting bringing together of people at the Global Digital Health Forum in Nairobi as well later this year, and your wisdom to share for people. So yeah, appreciate you being here in this space to do that.
You bet, Chubbs, and thank you for this platform. So hopefully people check out the conference, check out TechChange, find me on LinkedIn. I am available to do what I can to help support others on the journey that they're on.
Thank you so much, Nick.